Hi, I'm Echo Carrasco. I'm a medical student of the Catholic University of Santiago de Chile, and I will present a clinical case. Well, in order to make it confidential, I won't say the name of the patient, so I will continue through why. His date of referral was July 23rd, 2015. His diagnosis was head and neck cancer, of a type of squamous cell cancer in the left tonsil. And now, for you to know the background of the patient, well, he's a 58-year-old. He weighed 188 pounds. His BMI is 23.6, which is a normal range. He requires a caloric diet that runs 2,800 kilocalories per day. Plus, he needs to have a weight gain, and his food requirements are 2,565 milliliters, and he's actually having liquids and semi-liquid diet, which is well tolerated. He's a 50-year-old man who resides in the town of Antigonish with his wife and 3 children. Mr. White works as a lobster fisherman outside of Antigonish. During the fishing season from April until September, he's a hardworking individual who continued to fish this past fishing season despite a significant weight loss of 100 pounds. Finishing keynote and graduation in February 2015, and dealing with increasing oral pain and discomfort with minimal appetite. Mr. White has no significant history of smoking, stating he quit 32 years ago, and his food tolerance was better if he would enjoy 3 or 4 beer a day. His past medical history are prior nasal fracture, gout, chronic intermittent back pain, incidental fatty liver seen on CT scan, incidental heart murmur detected by the stethoscope. His common cell carcinoma of tonsil. These are thin, flat cells that are found in the tissue that form the circular routine, the lining of the whole organs of the body, and the lining of the respiratory and digestive tracts. The etiology was alcohol and tobacco, and in this case, he was affected by the human papillomavirus 16. The typical symptoms, the one he had were about palatal insufficiency, lower pain, feeling of food stuck in the throat, but patient could also present trismus of the tartar, dysphagia, and sputum. The current methods of treatment were chemotherapy and radiation. In chemotherapy, we could use 5-fluorouracil or cisplatin. He used cisplatin, and the radiations can be performed in 2 or 3 cycles. He was given 3 cycles of radiation, and it can also be surgery if the patient's profile fit with the with the profiles of a patient that couldn't have a surgery. Well, the diet history, his breakfast is oatmeal and unsure, his lunch eggplant and unsure, and the supper as the lunch. The patient education, malnutrition can make a person more susceptible to infection. Infection also contributes to malnutrition because of a disease cycle. And inadequate dietary intake leads to weight loss, lower immunity, mucosal damage, invasion by pathogens, and cancer-carrying nutrition. The prime plan, starting goal is increase proteins and calories. The second goal is blend meals. The third goal introduce soft fluids. And ultimate goal, eat more variety of vegetable fruits, whole grains and legumes. Limit red meats, avoid sugar drinks and ingredients foods high in sugar. Limit salty foods and foods processed with salt. Be physically active every day for at least 30 minutes, and limit the alcoholic drinks, if consumed at all, to 2 for men a day. The complication factors is pain in mouth, pains while swallowing, no appetite, no thirst, nausea, food getting stuck in throat, jaw restriction, and infections. Meeting 1. Initial assessment, currently trying, concerns, and PEG 2. The meeting 2, we have here the clinical history. We will pass it. You can see the sample menus. This is a menus he can eat in order to accomplish the goals he's proposed. On the medications is allopurinol for the gut, which decrease the levels of uric acid and increases the risk of infections. Celebrex with which is used to treat pain or inflammation caused by many conditions such as arthritis, and Yavolirocin for the mouthwash. The process used, the NCP uses a client-centered framework to clarify the role of the registered dietitians, nutrition practice elements and skills, and the environments in which registered dietitians practice. It incorporates an evaluation framework including identification of specific goals and monitoring of clinical and behavioral outcomes to improve the quality and effectiveness of nutrition care. Test statement, problem methodology, and signs and symptoms. Do you have any questions? Well, thank you.